Hey, good afternoon, everybody. Welcome back. We're here in Evanston still, and we've got Mikkel on the camera and Kate as our model today. Anyway, we're going to talk about lumbar spine, L-spine series. At Sterling, we do two pictures. Okay, unless you have a movable tube or a traditional X-ray machine, you can do a spot film, but we just don't do them here. So. Anyway, so we do an AP and a lateral, and these can be done either upright or supine. Most of the time we do them supine, just so you know, but it can be done upright. SID is 40 inches with no tube angulation at all. Central ray is at the level of the iliac crest. Easy peasy, okay? Collimation superiorly, we want to include T12 and L1, the disc space. I prefer to catch all of T12, the vertebral body, but if you don't get the whole body, that's okay. Inferiorly, we need to include the S or L5 S1 joint, or some of the sacrum in there. Laterally, we need to catch the transverse processes, which are those little bones that come off the body of the spine. And yeah, so we just want to catch those. We also want to catch both sacroiliac joints on the AP view. Technique, again, 70 kVp. It gives us a nice contrasty picture. On an average person like Kate, I'd probably shoot that between 30 and 40 mass. We're dealing with a little bit more there, so we need to use a little bit more mass. For the lateral, however, 70 kVp, we're going to probably shoot Kate at 100 mass. Depending on the size of the patient, if they're a very dense, thick person, you're going to go all the way up to 300 or 400 mass. So you're going to feel like you're cooking the person, but you're really not. So techniques or tips. When we image the AP, we need to make sure the patient brings their knees up. This helps take the curvature out of the spine, puts the spine right up against the table, okay, to reduce any magnification, gives us a little sharper picture. Also on the lateral, we want to bend those knees up to open up the joint spaces of the lower spine. Take care that there's no rotation. We don't want any rotation on these images. And our images will be exposed on expiration, okay? We're going to get all the air out of there and then have them hold their breath. So let's do this, okay? I'm gonna have Kate lay on her back with her head up here, okay? Very good. Okay, and yeah, I didn't guess very well, did I? All right, there. Okay. All right, so this is the AP supine view. You can do this upright as well. So we're gonna open our collimator all the way lengthwise, okay? 17 inches, you're gonna use every bit of it. So, but on the lateral collimation, we're going to collimate down a little bit. Is all we need to include are the sacroiliac joints and the transverse processes, okay? So we want to collimate that as much as we can on the AP. Have Kate bring her arms down to her side. I'm going to have you bend your knees up. If you have a sponge you can put under there, that's even better. We don't, but you'll note that that took some of the curvature out of her spine, and her spine is against the table now, okay? All right, so we're gonna feel for the top of Kate's hip, which is right there, and we're still too high, too low, something, okay. Okay, we wanna make sure that they don't have any buttons on their pants, zippers, they need to be gone, okay? Bra is okay with this one, and we're not gonna be able to use protection on this just because it's in the area of interest, right? Okay, so top of the iliac crest, that's our cross light, and then our mid-sagittal light is going right down the spine, right over her belly button, okay? Just like that, okay? So we are very, very well positioned right there. We can take our little marker and we can set it right there in the light, okay? Right on the patient's body, and it's not going to be in the way anywhere. If you're worried about it being on the sacroiliac joint, you can put it up a little bit higher, okay? Note that we're collimated You know, we got the spine going right down the minute. We just want to catch those spine or transverse processes right here. Okay? If you're open that way, you're in good shape. Good collimation makes a good picture on these. Just so you know, you don't want to shoot them wide open. You're going to lose some contrast for sure. Okay? Now I'd shoot this 70 at 32. I would have Kate take a breath in, blow it all the way out, and hold it. Okay? And you take your picture. Now, we don't want any movement or any artifacts that way on these pictures. Okay? Anyway, that's your AP. Just remember, top of the crest, mid-sagittal plane this way, collimate all the way this way, laterally. You're going to open it all the way, and you're going to tighten it up laterally. Okay? All right, let's do a lateral real quick. I'm going to have Kate move on to her left side. Okay? We always do a left lateral. So normally the patient's going to be faced away from you. Okay? So we've got her knees in. They're together and bent up. That's going to help us open up our spine right here, okay? The disc spaces, okay? I like to put my hand on the small of the back right here and just rotate her up. We want that to be perpendicular with the table, okay? Coming up this way, nice and straight. Make sure the arms are just up a little bit so we are not in the way of the lumbar spine. And you'll note, if I can move this in a little bit, there we go. Perfect. Okay, so there we go right there. All right, so right at the iliac crest again, right? And our line is gonna go right up the spine, which lies about 2 inches inside of the back. Now, if we have a little bit of light back here, that's great. That means that we're collimated really well, especially if we're following the spine up. We're going to have plenty of collimation this way. We don't want it wide open again, okay? Make sure you've got a little bit of light behind the back. Your central ray is going right up the spine. And whatever you got on the other side is perfect. We just want to be able to catch the anterior spine bodies, okay? All right, now I like to turn my tube a little bit. Kate's back is coming up this way. I like to follow the spine up, okay? So without turning the tube, it'll still be okay. It just won't be as straight on your image. So you're just going to turn your tube box so it follows the spine up, okay? So iliac crest, remember that? That's where your central ray is. Follow the spine up with your lateral line. You're open all the way laterally, and immediately you are collimated to the spine. So you have a little bit of light back here at the back, okay? You can use a marker at this point. You can put it right in that light right there. It's supposed to be an L. Sorry, guys, but we'll pretend that's an L. Always mark your left side when you're doing a lateral L spine, okay? All right, now we're going to do this image. I'll shoot this in 70 at probably 100 kVp, so we have some room to get through the transverse body right there, right? Because there's a little bit more on all of us. Don't be afraid to hit them hard with this if you have to. 300-400 mass is okay. So we're going to shoot it on expiration, okay? That's going to bring the lungs up a little bit so we can see the spine a little, okay? So a couple questions for today. What do we do with the patient's knees on both our projections? What do we do with those, okay? And for the SID, it's 40 inches, and when do we angulate our tube at all? Yes or no? Okay, so questions. What do we do with the knees? And do we angulate the tube? Okay, thanks for stopping by today. We'll catch you next time. We'll do C-spine or T-spine here in a few days, and it'll be good. So, all right, have fun with this. We'll talk to you soon. Bye.